Megha Ramprasad.
Sophie Brooks.
And today we're going to be seeing who serves the heart. So our criteria to select the patients are likelihood of survival. We don't want a patient that's only going to live 10 years after the surgery is done. We want a patient that has potential of living a long-term life. Our second criteria is post-surgery outcome, how the surgery is going to affect them after it's done. We want to know if it's going to affect them good or bad and how it's going to affect them mentally and physically. Our last criteria is financial state of the patients. We all know health transplant surgeries are expensive, so we want a patient that has a healthcare plan and enough funds, so they have to be financially stable.
So here are the pros and cons of each patient. So the first patient is the 41-year-old woman. So a pro would be that she maintained 14 months of sobriety and she has a family to go back and care for, which would be her daughter. Her company has also promised a job after her surgery, but a con would be that she's middle-aged and widowed, which can affect her mental stability after surgery.
The 59-year-old man. So he has a family to live for, and his family is very supportive, but he also has good work ethic because he works 60 hours a week. But his cons are that he's older and he has high blood pressure, which can be a major factor in the surgery with his survival. The 30-year-old woman is economically well off since she works a lot, and she can work remotely after the surgery to help recover, but her cons are that she doesn't have a very stable support system, and she smokes and drinks. She smokes a pack a day, and she drinks socially, which can affect her health after the surgery and during the surgery.
For the 45-year-old man, he's financially stable, has a good family, and has a good health. But for cons, he's middle-aged, which that could be a risk factor in the surgery. And for the 25-year-old woman, she's young and ready for the surgery, but she lacks stability. She doesn't have a good health insurance, and she has no family or support system.
So why did we select this patient? We have chosen the 41-year-old woman to be the recipient for the heart transplant. So one, she's not malnourished, since that greatly affects post-surgery life expectancy. And second, she wants to raise her daughter while sober, which is a positive sign of her commitment to her family and her role as a mother. And third, she was promised a job back after the surgery, which shows financial stability. So while she is our best candidate, there's still a limitation with choosing her. She is middle-aged, which means a younger candidate will not be given the privilege of aging, and instead, an older person, in this case an alcoholic, will be given a second chance.
So how does she fit our criteria? According to medical transplantation, moderate to severe malnutrition was associated with high mortality, which in a surgery, if the patient is malnourished, it can be a huge factor in whether they survive and live a healthy life after. And according to Stanford Medicine, proper laws have been put into place in order to make this procedure legal, so which makes it safe for the patients. Our patient is not malnourished, which means, because she's been part of the rehabilitation program, which means that she's been getting the help and the nutrition that she needs, and that will not be a risk for death after the surgery or during the surgery. The procedure is legal and safe for non-malnourished patients, so she will be more likely to survive, and she won't be at any risk during the surgery.
So this graph from heart valve surgery shows that most patients return to work 4 to 6 weeks after surgery. And second, according to pediatric transplantation, a total of 20 respondents reported that monthly out-of-pocket expenses greater than $1,000. So the woman will be able to return and care for her daughter without being financially responsible for the cost of the surgery, and her daughter will now have a mother completing their family.
So for financial state, we found that clinical transplantation is 100 and 120 million more per year to deliver the current volume of transplants performed annually in the United States. So now we know kind of like the price of how much heart transplants are in the United States. And according to United Network for Organ Sharing, the The OPTN is the transplant system of the United States that links all professionals involved in the U.S. donation and transplantation system in developing transplantation policy. So the woman's company is counting on this surgery for her to return back to work. So she was promised a job after the surgery, which that shows a financial stability because we already know that she has a job so she can pay for the surgery. We can assume the entire cost will be covered through the insurance, and she and her family will have a financial burden. So the good thing about this is that she won't have to deal with the stress of trying to pay the surgery because the company is already doing a lot for the financial part of the surgery. So now that she has a company and she has the family, so that will count as a support system, she fits the criteria. Thank you.
Thank you.
Thank you.